One of the super hot topics now in aesthetic medicine is what to do about this little problem of COVID. Specifically, how should you plan your treatments around having the COVID vaccine? Does having the COVID vaccine mean that you can't have any treatments done at all, and which treatments does it affect? The number one thing is going to be dermal filler injections. There are no problems with you having Botox or chemical peels or laser. The main interaction is really with you having dermal filler injections. Obviously, the vaccines have not been out for a very significant amount of time, so all the information around how to time your dermal filler injections around your vaccine is kind of a little bit guesswork. So if you're planning to have Botox, or you've already had Botox and you're having the vaccine around the same time, don't worry about it because there's no interaction there. More of an issue comes with fillers. Now, this issue is something that I spoke about in a YouTube video a few years ago, where one of the patients that I treated went on to have some inflammation in a dermal filler quite some time after the treatment. You may be interested to know that she has subsequently gone on to have more treatment done and has never had this issue arise again. So just because it happens once doesn't mean that it's going to happen to you repeatedly. And actually, I've also had this problem myself. It's not something which is reported super commonly after fillers, but if you've had fillers and maybe you've had, I don't know, gastroenteritis, or you've got a urinary tract infection, dental procedures, sinusitis, a chest infection, just anything which primes the immune system, the areas that you've had dermal fillers injected into can sometimes temporarily swell up. It's often not anything to worry about, and it's just a little bit. The most common areas for this to occur in are the lips and around the eye. And it's typically self-limiting, which means that we don't actually have to do anything about it to treat it. It's there for a couple of days and it just goes away on its own. So what exactly is this problem that we're talking about? Well, speaking about COVID specifically, it's a blockade of the angiotensin II receptors, of which there are a ton in the skin, and this causes a pro-inflammatory response which activates T cells. It looks like the area that you've had filler in becomes a little bit hard, firm, can be tender, and sometimes a bit red. And as I've said, it doesn't just have to be from the COVID vaccine. The mechanism of action is exactly the same, the treatment is exactly the same. There's a British group called the ACE group who've released some guidelines around when to have dermal filler injections if you are having the COVID vaccine, and they suggest not having filler procedures within 2 weeks of your planned vaccination or within 3 weeks of having received it. If you do have a problem after having the vaccine, they suggest taking 40 milligrams of oral prednisolone for 5 days, or dexamethasone 5 milligrams for 3 days. These medications are both steroids. Because you'd be taking it for less than 2 weeks, it's not going to be sufficiently immunosuppressive to be something to worry about. If you do have a problem like this occur, it is much better though to nip it in the bud as soon as possible, because if you leave it, that one filler site that you're having the problem in can suddenly then become 2, can become 3, and so on. It's not always absolutely necessary to remove the filler. Sometimes these issues just settle down after a course of steroids and you can leave the filler there. If the issue escalates, the ACE group suggests taking doxycycline 100 milligrams twice a day, or minocycline 100 milligrams twice a day, because these are antibiotics, but they also have anti-inflammatory properties as well. There are some other medications which can be used in non-responders, but let's hope that it doesn't come to this, such as injecting the lesion directly with steroids or 5-fluorouracil. Interestingly, there have been some case reports of people responding well to antihistamines, even though antihistamines are not normally used for this type of issue. The pathway is different, it shouldn't work. Interestingly, the reason for suggesting 3 weeks is all to do with how the vaccine works. For example, with the Pfizer vaccine, the immunity within the first 2 weeks after administration is almost 0, but it's around 90% after 3 weeks. Basically, you don't get the immune response for that period of time. Also, at the time of the ACE guidelines being written around March this year, there were no documented cases of this occurring using the Oxford or AstraZeneca vaccine, as this is a non-replicating adenovirus vaccination, which is different to the Moderna, for example.
Now, if you are still concerned, you could go to a provider that is using the Pfizer vaccine instead of Moderna's. Pfizer's has shown no such side effect so far, and a lot of the major hospitals here in the Kansas City metro are using the Pfizer vaccine right now.
The data from the Moderna vaccine trial highlighted 2 cases of facial swelling and 1 case of angioedema in patients who had previously had soft tissue fillers in these areas. As the study contained 15,184 patients, and there were 3 people to whom this occurred, the numbers aren't exactly that high, but it's obviously something to be aware of. Although in a paper from January 2021, it showed that the AstraZeneca, the Moderna and the Pfizer all reported cutaneous adverse reactions in the vaccine groups, as you can see in this table. Things that I've noticed in the clinic, I did have one patient who had long COVID who got this problem pretty badly, but they responded extremely well to steroids. And I had another patient who had had the vaccine, I don't know which one, and again she got some lip swelling, but that resolved very quickly when she started taking some antihistamines of her own accord. Some people are a bit worried about using steroids when they have a problem like this, if they are worried that they've got COVID, but as I'm sure you've seen in the news, steroids are used as a treatment for COVID. So you can't go wrong there, really. Unless, of course, you've got a bacterial infection. It's not COVID at all, in which case you might be a bit up the creek. But that's why it's important to have a diagnosis before you start treatments. I hope you found that informative. Has this problem happened to you, or do you know someone that it's happened to? It's probably more common than you'd think. I'll see you guys again next week.